right, second video on the foot. Welcome back, guys. Dr. Ray Miller here, physical therapist and fellowship trained, orthopedic manual physical therapist. So this series of videos with Spill breaks down foot pain. And last week I talked about plantar fasciitis, or plantar fasciitis as I called it, and kind of how we differentiate that and how we treat it and what to look for with true plantar fascial pain. And I did misspeak in one part of my video pointing to the heel of the foot, but that's going to be this week's episode, is looking at the foot and pain in the foot, but more in particular when you get that diagnosis of heel pain right there. And I'll talk about the different factors today that can give you pain in your heel, especially when striking or when you first step down on it in the morning, that pain that you get there, as well as, what we look for to really figure out what's creating the pain. So I'll have a picture of the foot up again, and we'll kind of dive into what that heel pain means. So typically, like I said, you'll come in, you'll have pain right on that heel, right? And people will think, oh, it's a heel spur or it's something like that. And that may be true, but it doesn't mean that it's your provoking pain, right? So things that can lead to that heel pain, or it can be the spur. It can be if one is there. It can also be, and this is when you dive in and you go through the mechanics of the foot and you assess the mobility of the foot, you can get stress in that heel because you're lacking the ability to point your toe up. So if you can't point your toe up, it's going to pull on that heel, and it's going to pull on that Achilles, which attaches into the heel bone, and that's going to actually put some increased stress on that foot. So you have to make sure that the ankle joint itself is moving properly in order to stabilize the normal movement and mechanics. So that's the first thing I look at, is, are the mechanics there? The other thing that can create heel pain that's way underdiagnosed and part of treatment that we don't see very much is the fact that you have nerves, and you can see in the slide that you have these yellow nerves that kind of trace underneath the heel and branch off. It's called your medial and lateral plantar nerve. And those are branches of a bigger root system that goes up, 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 and ends up starting in your low back. So it is not out of the question for me to treat someone with heel pain by treating their low back and the nerve that travels. That's the only thing in your body that will travel from your back to your heel. So we make sure we rule out any nerve irritation with some special testing there. And then the last part, it can be when you have feet, that pain underneath there, is it can be a lack of foot strength. There are some testing out there, and I've said this before to my patients, that we're better off walking on our hands than our feet, because we're actually much stronger here than we are on our feet. And that's a huge issue as to how the foot positions and goes from this supple, flexible foot into a strong lever to push off with, especially when walking or running. So to have full strength at the toes, at the small muscles of the foot, if you have that, then you're less likely to have that heel pain as well. So we look at all those factors to determine what is the best strategy to treat that specific tissue that's being irritated. So not all heel pain is the same. Typically we see people who get like heel cups, or they put in cushions in their heel just to take pressure off of it. That won't solve the issue. That's a Band-Aid. Injections, Band-Aid, because that doesn't change anything with the tissue. It just controls the pain. And I'm not saying that's not valuable to some people, but it's not going to fix the underlying problem. So if you're having heel pain, find someone that can really dive in, and I'm one that really loves the foot. So find someone who loves the foot, can help you figure out where your pain is coming from, what tissue is affected, and how to properly treat it. So look forward to the next episode. I'm probably going to talk about this whole issue with pronation of the foot, or flat feet, and we'll kind of dive into that. So stay tuned, guys, and thanks for watching. Take care.